We talk a lot about getting a patient's consent in healthcare, right? But what happens when the patient just says no? This is so important to understand. Legally, ethically, a competent patient's right to refuse treatment is just as powerful as their right to give consent. So let's get into what that really means.
Okay, first things first. We have to start with the one principle that every single clinician must respect, and that is the patient's absolute right to refuse care. It's really the core of modern medicine.
And this all comes down to one key idea: patient autonomy. What does that mean? Well, it means that we, as the doctors and nurses, have to respect a patient's choice, even if we completely disagree with it, even if we think it's the wrong medical decision. At the end of the day, it's their body, and their decision is what counts.
And don't underestimate how powerful this right is. I mean, we are talking about a competent person's legal right to say no to life-saving surgery, to refuse critical medication, even to walk out of the hospital. The law really protects a person's control over their own body, above everything else.
So, okay, the patient says no. Before we just accept that, our first and most important job is to make sure they're actually, well, competent to make that call. So how do we figure that out?
Now, figuring out if someone has decision-making capacity, as we call it, isn't just a hunch. It's a proper assessment. There are basically 4 things you have to check. 1, can they understand the information you're giving them? 2, can they appreciate what it means for them personally? 3, can they reason with the options, weigh the good and the bad? And finally, 4, can they tell you their choice in a clear way?
And you always have to keep an eye out for red flags, things that tell you something might be wrong. Is the patient intoxicated? Are they confused, maybe delirious? Is their pain so bad it's clouding their judgment? Or do they have a known psychiatric illness? Even just waffling back and forth, making inconsistent decisions, that's a huge sign you need to dig a little deeper here.
All right, so let's say you've confirmed they have the capacity to decide. The next step is a really important conversation. It's not just about hearing their no and walking away. It's about making absolutely sure that their no is an informed one.
And being clear here is absolutely everything. We have to explain, in language they can understand, exactly what the illness is, what treatment we're suggesting and why, what could happen if they refuse, and yes, that includes the worst-case scenarios, and of course, any other options they might have.
Now for maybe the most important question of all, why are they refusing? You have to ask this, and you have to do it respectfully. The goal isn't to argue with them or pressure them. The goal is to understand where they're coming from.
Because that why can tell you so much. Maybe they're just scared, or worried about the cost. Maybe they just misunderstood something you said about their illness. Sometimes it's about their religious beliefs, or a bad experience they had in the past. If you can figure out the reason, you might be able to fix the problem, like clearing up a misunderstanding, and they might even change their mind.
And here's another thing we have to do. We need to make sure this decision is 100% theirs. You'd be surprised how much pressure can come from an anxious family, or even from hospital staff who just want the best for them. If you suspect someone is being pushed into a decision, it's always a good idea to find a way to talk to the patient alone.
Okay, so we've had the conversation. Now we come to what is, from a legal perspective, probably the most important part of this whole process: the documentation. And let me be crystal clear about this. Your notes, your detailed documentation, that is your legal shield. It's what protects you if someone later claims you were negligent. Getting this part right is absolutely not optional.
So the big question is, what does a good, legally solid note actually look like? What are the key things you absolutely have to write down?
Think of it like telling the whole story. You need to write down the patient's condition and what treatment you recommended. You need to detail all the risks you talked about and the alternatives. You have to note down that you assess their competence. And this is so important. You have to write down the patient's own reasons for saying no, in their words, if you can. And if it's at all possible, getting the patient and a witness to sign it is always the best way to go.
Actually quoting the patient is an incredibly powerful tool. Writing something like, patient stated, quote, "I am afraid of surgery and want to consult my family first," end quote, that's gold. It shows exactly what they were thinking, and it proves that you were listening.
All right, last but not least, what happens when the patient decides they're actually going to leave the hospital or clinic against your advice?
Well, in that situation, you need to use a formal document. It's usually called a Discharge Against Medical Advice form, or a DAMA. This form is the final piece of the puzzle. It's the signed proof that you explained all the risks and that the patient chose to leave anyway, completely on their own.
So, let's wrap this up.
Respecting a patient's refusal isn't just a rule. It's a core part of being an ethical doctor. When you make sure they have capacity, give them all the information, and document everything carefully, you're doing two things. You're protecting the patient's rights, and you're protecting yourself professionally. That's how we protect doctors and empower patients.